I'm Dr. Daniel Kantor in real-time neurology. I'm joined here by Shaheen Virani and by Joe Stuckey. Shaheen is a vocational rehabilitation specialist at the MS Center at Swedish, and Joe is a vocational rehabilitation specialist at the University of Washington Medical Center. Both of you guys from the Seattle area. But I think a lot of people back home are thinking, what is a vocational rehabilitation specialist? Joe, what is a vocational rehabilitation specialist?
Clinical rehabilitation counselors or vocational rehabilitation counselors specialize in the impact of health changes on employment. Shaheen and I have been colleagues for many years. We both work in MS specialty clinics here in Seattle, and both of our clinics have embedded into each of the programs vocational specialists to address the impacts of MS on employment. There is national certification which you can look for these credentials. It's through the Commission on Rehabilitation Counseling Certification, and we're proud to be part of what we feel are strong interdisciplinary rehab therapy teams.
Shaheen, if somebody with multiple sclerosis wants to retain their job, are you the type of person they should be speaking to?
Absolutely. But I really think it is a team effort. So one of the things that I talked about today was it takes a village, right? It really takes everybody working together to keep people employed. It takes the neurologist focusing on any medical interventions, and it takes the speech pathologist, the occupational therapist, the physical therapist, all of us working together, because employment impacts so many different areas, right? We need to address all the different limitations, cognitive limitations, physical limitations. And where Joe and I come in is we can sometimes coordinate these different disciplines, identify where the needs are, and then decide what type of interventions are going to be needed at the workplace. So, for example, job accommodations or leave associated with perhaps a flare-up.
It sounds almost like when it comes to the team approach for multiple sclerosis, instead of us thinking about one quarterback, what we should almost be thinking about is when we're dealing with individual issues that a person with multiple sclerosis has, there may be a different team member who takes the lead. So for example, if it's about a medical issue, which disease-modifying agent to be on, it's natural for the neurologist to take that team leader approach. But there's other people who are important in that. But if it's about the person's upper extremity function, it may make sense for the occupational therapist. If it's about a person's job, someone like you guys would be the person to take that approach and then work with the other team members and bring them in. Now, you're both lucky enough that you're at comprehensive multiple sclerosis centers.
Yes.
For somebody who's not at one of these centers, is there a way to get access to vocational rehabilitation? Are these things that are covered through insurances? Are there grants available? How can people access them?
When there is not a vocational specialist within clinic or accessible, which is the case in many situations, we recommend people reach out to their local rehabilitation agencies, voc rehab agencies. Each state is mandated to have vocational rehabilitation services. In many states, they're located throughout the state. So looking up vocational rehab in your own state is a great next step.
How about the not-for-profits? As we know, there are not-for-profits in MS that are big, that are small. Have you guys found any one not-for-profit who's more likely to work with you and your patients?
Not-for-profit.
The Job Accommodation Network is an excellent resource. It has extensive information on the accommodations process, guidelines for health practitioners in walking patients through the accommodation process.
And not just patients, but employers and providers. So the Job Accommodation Network is actually staffed by occupational therapists, attorneys, physical therapists, vocational rehab counselors. It's a multidisciplinary organization.
We've been doing these videos now for a little bit over a decade. And whenever I see that pause, when people are thinking, well, there's something else we can do better, that's an opportunity for us to do better. And we can only do that if we do it together. I want to thank you both for joining us, and I want to thank all of you back home.